Welcome to Good Tech, Compassionate Healthcare, an AMS healthcare podcast that explores the convergence of technology and compassion in healthcare. We host conversations between leading researchers, scientists, and healthcare providers as they confront the challenges threatening our current and future healthcare system, especially in the face of the pandemic. We see an incredible opportunity for digital health to innovate medicine and clinical care, healthcare education, home care, and beyond. That said, we hope to foster an open-ended discussion about how to integrate technology into the healthcare system in a way that enhances and doesn't diminish compassionate care. Ultimately, improving the experience of patients, caregivers, and healthcare providers alike. If there was ever a time to uphold compassion as the bedrock and guiding principle of healthcare, it's now. Join us now to explore Good Tech, Compassionate Healthcare, brought to you by AMS Healthcare. In this conversation, nursing professor Claire Mallette, medical educator Tina Martimianakis, psychiatric resident Erene Stergiopoulos, and nursing student Ola Thomas Obewu reflect on the challenges of teaching and learning compassion in this digital age.
Hello, everyone. My name is Dr. Claire Mallette, and I am so thrilled to be here today and participate in this exciting podcast on teaching compassionate in digital healthcare. I am a nurse. I am an associate professor at York University, and I teach undergraduate and graduate students. My passion has always been about compassion and caring, and how do we implement that in practice and not lose it. I want to tell you a little bit about myself. As I said, I'm an associate professor, but why did I choose nursing? Well, true confessions, I wish I could say it was a true calling, but it wasn't. When I was finishing up high school, I had to choose in what direction to go into. And I was thinking, well, I like health, I like science. Nursing might be a good place to start. I had no idea of how exciting this career would be, the difference I could make with the people that I work with and care for, and most importantly, being able to be with people at their most wonderful times, such as having a baby, their most vulnerable times, and as they leave this world. So I'm thrilled to talk more about it, but I'm even more excited about introducing Ola, who is a third-year undergraduate nursing student at York University, and she's going to tell you about her journey, and I'm going to let you introduce yourself, Ola.
Thank you so much, Professor Claire, for that introduction. Just like Professor Claire said, my name is Ola. It's Ola Thomas Obewu. I just finished my third year in the nursing program at York University. Venturing into the healthcare field really stems from my desire to make a difference in someone's life. You know, when I started the nursing program, I actually wanted to go to medical school, but just being a nursing student, being part of people's life and positively impacting them and their lived experiences has made me want to advance in this profession. And I hope to get my master's, be a professor like my Professor Claire at some point in life. And at the same time, also remain a clinician, because that would give me the opportunity to keep making differences in people's life. And also, like I said before, I have passion to serve humanity in an authentic and compassionate way. And I always say in an authentic way, because when you show compassionate care, it is something that has to be genuine. It has to come from within. And at the end of the day, I derive fulfillment by providing care to people, especially in their vulnerable moments. Right now, I am a clinical extern in an emergency department, and I've seen a lot of patients, people who have lost loved ones or family members who need care. Every time I help someone on my way home, I feel accomplished, and nothing can beat that. At the end of the day, at the core is providing compassionate care, and I'm very proud and I'm humbled to be a nursing student, and I hope to be a nurse, a wonderful nurse someday.
Hi, everyone. My name is Tina Martimianakis, and like Claire and Ola before me, I also didn't have a direct pathway into medicine, but found my way here because of a desire to make a difference. And for me, healthcare education is a space where we get to see so many social and cultural intersections come together, not always fluidly, but giving us the opportunity to crystallize problems that we have in society in a way that can make immediate difference to those of us who have a need in the healthcare system. So for me, that group is one of our most vulnerable groups. So I'm not trained as a clinician. I'm a social scientist, and I work in the Department of Pediatrics at the University of Toronto at Sick Kids Hospital. And every day I go to work, I'm reminded about that vulnerability, both as a mother, as a wife, as a citizen of Canada with our multicultural history and its problems. And I have a desire to see anyone represented in healthcare find a voice and have a platform to share their need and be cared for in a way that's meaningful to them. That opportunity is a huge privilege. And I'm very excited to be here today to discuss how education sits at that crossroad that we were talking about earlier and facilitates a caring, compassionate orientation. The biggest privilege of all is to actually work with the students that find their way into healthcare. And I'm very excited to be here today with Erene Stergiopoulos. And over to you, Erene, for your perspective.
Hi, my name is Erene Stergiopoulos. I'm a second-year resident in psychiatry at the University of Toronto. What brought me to medicine, my first interactions with medicine were actually as a patient with a chronic illness. That experience just taught me how hard it is to navigate the healthcare system, how many subtle parts of the experience as a patient are shaped by the environment, by the interactions. And so I think that my desire to go into medicine really came from that, from finding a lot of difficulty in being a patient. That, in turn, in medical school led to research that Tina and I have been doing together and continue to do together about the experiences of medical students with disabilities and chronic illnesses. And so that's sort of become a place where we're understanding education and how we can create environments for these learners who bring so much compassion and so much understanding to their roles as healthcare providers.
So we're here today, the four of us, to talk about digital healthcare and compassion. And all of us have certainly never imagined that we knew digital healthcare was going to come down the road, but we never knew we were going to be forced into it. That with the pandemic and lockdowns, that we all got pushed out of our comfort zone, or at least certainly for me, a lot earlier, and had to then reflect on how do we teach compassion, which is hard enough as it is. Because I know if I look at Erene and Ola, and that all you want to learn are the skills. The skills are what define me. And compassion, that's just a soft skill we can do afterwards. So how do we do it digitally? And for myself and Tina, we had to turn on a dime to try and figure this out. So for myself, I found it really challenging. I found it challenging, the technology. I'm from the baby boomer age. I am certainly a digital immigrant, not a digital native. So how to get it done digitally and convey those intimate, usually oftentimes behind a curtain, or those times, or not even, how do we convey the importance as well as the ability to do it? For me, one of the ways was storytelling, to let students know. And it's interesting that Ola and I had this discussion, and I'm just going to tell my story and then we can jump in. But we often call compassion being the little things. But in actual fact, they're the huge things. They're the things that make that difference. And they're the things that people will remember you for forever. When my daughter was 4 years old, she had asthma. I had to get her to the hospital. I was told that she was going to be admitted at 4 a.m. in the morning. As I stood getting the news at the nursing station, I said to the nurse, I said, is there any way where I can get a coffee? Because I knew I needed to be alert and on the ball to support my daughter and care for myself at the same time. He said to me, and in those days, it was a long time ago, my daughter's now in her 30s, there was these horrible coffee machines that taste terrible. He says, no, it's just machines. I went, okay, where do I go? He said, hold on a moment. And he came back And he went into the nursing break room and he came back with a steaming hot, fresh cup of coffee. And he said, here you are. Here's that coffee for you. One might imagine that that's not what we do. That's not the knowledge we need. But in actual fact, he applied the knowledge, skills, and ability to recognize that's all I needed. So now, how do we do that digitally? And one way is telling students that story.
Even before we went online, I had challenges incorporating compassionate care into my nursing practice. See, as students, we're taught to do no harm. You have to avoid medication errors. You have to be on time. So I was very much task-oriented. Now, I already had problems with expressing compassionate care. And I remember during one of my evaluations, my clinical instructor said to me, you are very task-oriented, but I know you have the zeal to care. So I want you to, take a breath sometimes, even when you're doing the vitals, just simply explaining what the vitals means. That is actually a caring moment. Or saying, oh, I'll be back to make your bed. Do you have a family member coming in today? Do you want something from me? I don't have that anymore because everything has gone online. Having my clinical placements online, it's a huge, huge barrier for me to even develop my compassionate care component. We have these virtual simulations, and the truth is, it's just a game. So I wake up every morning, I say to myself, well, you just have to hit a 90%, and that's it. They are all medical, surgical scenarios. There's no platform for compassionate care. There's just no way to even know what compassionate care is. It's a pity that I just don't know where to begin. And now I am an externship. I begin to realize VSIM is actually a game. Being a caring nurse is not what I do on VSIM. I've had the opportunity to do, like Professor Claire said, it's those little things, but they are the caring moments. For example, I had this family member. She came in with her husband. She needed to speak to her son, and she kept saying it. But then, I asked myself, how can I help? I had to take her to the nursing station. I gave her a seat. I dialed the number for her. She needed a pen and a paper. I gave it to her. She kept saying, thank you, thank you, thank you. And I'm like, well, you're welcome. But actually, it's those little things you do. Those actually what makes a difference in people's life.
Totally. For me too, like this past year, it went from elation that I could actually log on to Zoom, and we had to pivot. Like Friday, we were told, okay, your Monday morning classes have to be virtual. You have to learn this platform. This is it. You have to do it. We have to finish the term, people. And you had the weekend to figure it all out, and elation that we can actually do it, to grieving. Like I spent the past year grieving all the loss that I feel as an educator, not having access to the techniques I had to build those relationships in the classroom. I teach a lot about critical pedagogies and perspectives because the goal for me is to open up space for conversations, to enable knowledge flow across disciplines, but also for us to be able to access the lived experiences of patients in ways that we may have not trained to do because we've been standardizing what it means to care. If we want to expand what it means to care to include perspectives from across cultures, across religions, to build in that space that we must build in again, or to release the space that we've encroached on our Indigenous peoples here in Canada, we need to create that room, and we need to take back what we used to say was good care and create the room to negotiate new versions of it. Well, you can't do that when you're teaching to a screen. For privacy issues, there are so many different things to balance to afford learners to be comfortable and feel safe to engage in a virtual environment means that often I only see the names. I never see the people behind the names. So for me, that's a huge loss as a teacher. And it's not the same thing. I can't see when I've said something that may have come across wrong for one of the learners to take that moment to apologize or fix it. I can't see that connection between two learners in terms of what they're saying so that I can amplify that in the session. And that relationship building is lost to us. And I feel that has compromised what caring education can look like, because relationship-based techniques are the care that we bring, and not only the classroom, but to any educational encounter.
Switching to the virtual environment, we've lost a lot. There's this almost ritual or reverence that we bring to our in-person encounters. It's the look in your eyes, even when you're wearing a mask. There's so much that we communicate through our faces, through our eyebrows, and it is very hard to replicate that in the virtual environment. At the same time, one thing that I've been noticing is that there are these small ways that we can insert it. When I see patients on Zoom, we don't use Zoom for patient care, but we use whatever clinical platform like OTN or WebEx. it's the small moments when there's, for example, a technical glitch and we're frozen and we're in the middle of a psychiatric interview or a therapy session. And then like the system crashes and we both have to log back in again. Like that's terrible. You know, you break that kind of beautiful alchemical moment that you have with your patient. And at the same time, there are ways to recover in this very compassionate way, whereas like they're stressed. Oftentimes they'll blame themselves. And sometimes it's my Wi-Fi connection. And just like taking that moment to say, no worries. Let's just get back to where we were, and kind of just all forgiving ourselves for being in this brave new world of care that none of us had anticipated would be such a reality, like Claire was saying.
It really makes us look at different ways. It's forced us to go into this digital, and how do we then capture it all, recognizing that it wasn't the way it was, and it never will be, unfortunately. So I love it, Erene, what you said about, behind a mask, how do you convey with your eyes? And as educators, it's really important for us to find those new strategies and ensure that they're incorporated so it's not just a video game.
And even like basic things, you talked about the little things we can do to create the room for that humanism to enter back into what I feel is a very sterile learning environment when we're doing it digitally. You have to cut back on other things. So the sessions can't be overwhelmed with didactics. They can't be overwhelmed with theory. So building in those stories, sharing of yourself, role modeling what vulnerability might look like to the learners to give them some practice so that they can pick up on it when they see it in patients as well. What does that even look like? How do I show my frustration? How would you know that your face is frozen because of Zoom and not because of apathy? Like, right? It takes a few seconds.
You're so right. Ola, you were telling me about role playing and how that makes a difference even in this video digital world.
Well, we don't have the opportunity to have real patients. But one time I had this assignment where we had to role play, and I was the nurse, and my classmate was actually the patient. She had anxiety issues and she was going to go in for surgery. She wasn't going to take this anti-anxiety medications. I had to explain it to her. Well, she was acting like she was losing it. Well, that made me to be present. I was forced to be compassionate. I cannot lose it. I had to record it. I had to submit it. I had to put in my best. I asked myself, how can I care for this patient in a compassionate way to support this patient, embrace positive and negative feelings at the same time? It really helped a lot because I began to explain to her, I'm here to help you. Compassion comes with an action piece. So this is what I will do to support you in this way. After role playing, I had to reflect, wow, I was actually a nurse. I was not just talking about, well, your anti-anxiety medications will do X, Y, Z, but it was a holistic care that I was providing to my patient. So role-playing goes a long way.
If you find this conversation interesting, check out the AMS Healthcare best-selling book, Without Compassion, There Is No Healthcare, where 28 outstanding Canadian healthcare leaders confront the challenges threatening our healthcare system. Find it wherever you buy your books. Now back to our conversation.
What have I learned from these times in COVID? I think self-compassion has been actually one of the biggest things I've learned. I think that with everything virtual, I've done some clinical rotations entirely virtually. And even just looking at my schedule, like if I open up my iCalendar, I see just blocks and blocks and blocks, appointment after supervision, I don't book a lunch oftentimes. You sort of just assume that, I'll just eat lunch during supervision hour. And then you realize also that the time that you take with the patient, like you give them the full hour, the full half hour. If I was in the clinical environment, if I was at the hospital seeing outpatients, I would usually have at least 5-10 minutes between patients. I'd get up and go to the bathroom. I'd go and I would get a coffee. I'd go downstairs and hang out in the hospital lobby just to stretch my legs. And that doesn't exist when you're on your computer in your living room or in your office. People are getting burnt out. The number of clinical supervisors I've had who told me very, very genuinely, I am so burnt out right now because we just schedule our days so tightly in the virtual care environment. So I've learned to take true vacations. First of all, I just didn't take vacation because it's there's nothing to do. I'll just keep working. Then I started taking vacation because it's I have these vacation days. I need to take them. But I would just end up working. I would do research. I would do other things. But I got to the point where I was doing 4 months of virtual care for the whole thing. The only thing I had in person was working in the emergency department on call. Those 4 months were brutal. They truly were. And I had to take true vacations where I canceled meetings. I canceled even my regular therapy patients who I see every week because I was like, I need this space. And it was interesting because like my supervisors were like, oh, I think I should do that too. We have to give ourselves permission to take space away or to take ourselves away from the kind of onslaught of clinical work. Because with the accessibility of Zoom and virtual care, I think we also kind of expect ourselves to always be accessible to our patients. Now, instead of there being an assistant who books my patients for me, I just email my patients. They have my email, and so they have easy access to me all the time. And so navigating that is really challenging because when do you turn off? When do you say, okay, I'm not responsible for this right now? So that comes into coverage, that comes into teamwork and understanding, okay, if I'm not here for a week, who's going to cover for this? So yeah, I would say the self-compassion has been the biggest learning.
That totally resonates with me, Erene. I'm not doing the clinical work, you're doing the heavy lifting here, but the constant, like there's a new way to be accessible now. This has made it very hard to transition into spaces where you can shut down the work because the work is now everywhere. It's in your home, it's in your bedroom. I've had to use every single part of my house has been used for work. So now everywhere I go, it reminds me of something on my to-do list. And the other thing is sharing your home with so many other people trying to work from home has also been quite challenging. How do you take care of your family and yourself and balance the work? It's been rewarding to see that the interest in things like education has not waned. I think these challenges that we're all experiencing, either as faculty or as health professional learners, have made us very aware that we need to continue to study these approaches, that there's a commitment to thinking about the role of education in the delivery of care. So that has been very rewarding to see.
Well, just like Tina, Erene, I've really learned how to be kind to myself. When COVID started and we went online and I said, well, I'm just home. I can keep working. I can do this. I can do that. No, I was very burnt out. And at some point, I said to myself, you know what? Because I'm very active in school. I'm a part of a lot of extracurricular activities. I was tempted to drop them all because I was so hard on myself from the start. When I want to sleep, I just sleep. You know, when it's time to eat, I eat. I don't really bother so much again about how I have to be the best. Oh, no, we are really going through tough times. It's very unpredictable right now. And because I know that, I'm so kind to myself. I'm very flexible and open-minded. And I think the school really thinks we are just home resting. No, I have so much assignments. So please be kind to me. So I can be kind to myself. I can be kind to my peers. And when I go back into the clinical setting, I know what caring is. I will care for my patients in a compassionate manner. I'm a clinical expert now, and it's not all about drawing IV samples, blood, or suctioning or bed change. No, it's not all about that. Because, you know, the other day I came into the room of a woman who had just lost a baby and she was there all alone, you know, sucked in her blood. And she said to me, can I get a brief? I'm like, yes. But then I look at her, there's blood everywhere. So, you know, I took my time, I cleaned her, changed the bed, took her vitals, and I could just see from her face, she felt relieved in a way. Then she was able to call her family. All those things are the caring moments. So we need things to keep reminding us that this is what nursing is all about. This is what the healthcare is all about. It's about compassionate care. And if at any point in time, you don't feel your practice embodies compassionate care, then, I mean, I think there's a problem, because at the end of the day, it's the foundation of everything we do.
So many good ideas. I think what resonated for me listening to all of you, we're in a changing time. And how do we embrace what has worked and push us into places we never would have been? Like Erene, when you talk about being able to meet a physician or an appointment digitally is amazing. Whereas you say, not waiting, it's so convenient. But then as educators, we now have to look at, okay, so how do we then support our learners in being able to do that? Being able to assess the person, to convey that compassion in different ways that we may not need to. I also think of how do we, we all have this challenge of what do I look like on Zoom? So how do we also help our students and our learners learn about this whole new world in preparation of doing an interview? and the things that we need to incorporate. I think the genie's out of the bottle. And I'm not sure we want to put the genie back in completely. But how do we take what's good about what's happened or doing things in different ways and then incorporating what we need to do to ensure we don't lose the compassionate piece, those other pieces. I think about, as artificial intelligence and these videos, virtual simulation, those can be a good thing, but we need to supplement them with that dialogue, with those exercises, with challenging students, showing videos. And there's this wonderful video I show from the Royal Alexandra Hospital Foundation. And it's all about this. Well, I'm not going to ruin it for you if you go on to it. And it's called The Difference Between Care and Caring. And I think that's the key that we must not lose, whether we're digital or face-to-face, is that piece about care is providing the physical what they need, but caring is introducing more, looking at the person holistically, identifying what are those things we do to meet them as a whole person as we're caring for their physical needs. We also have to teach about resilience too with our students. It's all different now. So how do we do all of those? So I think I'll leave it at that.
I will speak to my relationship with Erene from my own personal point of view. And for students like Erene that I've had long-term relationships with, the pivot to this virtual wasn't as difficult. We had an established relationship, so we could fall back on that. We could still talk on the phone if we were tired and our eyes were swollen from Zoom. Whereas with the newer students, we had to make that face-to-face connection because it took longer for us to get into a groove and to learn each other's quirks and not be performative, like performative in the sense of, oh, what are they thinking about me? We can be ourselves, because that relationship building is very important when you're doing this kind of work. So I was very grateful to have those relationships with Erene and other graduate students and clinical trainees. They were a continuity for me. And I could hear from them and their stories, things that I couldn't see anymore. I had lost my vantage point as a teacher working from home. So I was very grateful to have that. And that was very sustaining. You spoke earlier, Claire, about resilience. For me, those relationships were the things that kept me motivated when I lost the other things that made my work so happy and enjoyable. They were completely taken away. And the things that I was able to retain very meaningfully were those relationships with my mentees, graduate students.
I know that a big part of the positive parts of my experience have been so much thanks to my mentors, my supervisors, Tina. I remember, Tina, we had a research meeting at some point early in the pandemic, like I think March 2020. And I was in a 3-hour line to get a COVID test because I was on internal medicine at the time and had like a little sore throat. And back then, like you were immediately off duty, you had to get tested. I mean, still, we had this like, I think 60 or 90 minute phone conversation while I was in line in my scrubs. And like half of it was just checking in and be like, what is going on? Are you okay? Like, what is your life like right now? And that is so valuable to feel cared for by the people who are your mentors.
This was amazing. I can't tell you how much I got out of this conversation, just hearing others. There was a little bit of commiseration, but also, the hope about, this next step that we're going to take, and virtual is not going away, and we're developing some strategies, and I can't wait to see how this evolves into a caring and compassionate agenda, which I think is going to be very important.
Yeah. Just imagine. Think about what we've managed to achieve where we had to spin on a dime. Just imagine when we're thoughtful about it and take what we've learned and be able to apply it to the future in supporting our wonderful new healthcare professionals who will be able to and be probably far more nimble and adaptable in doing this in this new world of digital health and always holding at the center compassion.
This has been an extremely affirming conversation. It's really, really nice to be able to talk about things that have been hard and to see Claire and Tina well into their careers being like, yes, this is really hard. It's like, wow, as a learner, it's really great to hear from their experiences and to see those experiences mirrored. Like we're all going through this right now and we're all imagining this future and how we can make it work and how we can make it a caring one.
Well, I am a novice right here. I feel like the baby. So just being a part of this, I don't know the right word, but it is an honor. And I'm so glad I met everyone here. And I really look forward to working with you, well, in any way. And yes, thank you so much for this conversation. It really made my day. It made the rest of the year. Thank you so much.
Thanks for joining us to hear our conversation, Teaching Compassion in Digital Healthcare. And many thanks to Claire, Tina, Erene, and Ola for sharing their candid thoughts. Join the AMS Healthcare conversation next time for digital interventions during COVID on mental health with some of Canada's leading healthcare experts in mental health, David Wilger, Gillian Strudwick, and Alison Crawford. Thanks for listening. Join the AMS conversation next time on Good Tech, Compassionate Healthcare. Works to advance a Canadian healthcare system through innovation and technology while remaining rooted in compassion and our medical history. They convene networks, develop leaders, and fund crucial activities in medical history, healthcare research, education, and clinical practice. Their work helps improve care for all Canadians. For more information, visit amshealthcare.ca to access their wealth of resources and view their funding opportunities. AMS Healthcare has recently published a best-selling book, Without Compassion, There Is No Healthcare, available wherever you buy your books. A series of articles based on this book are available on healthydebate.ca.
This podcast was produced by Michael McDonnell, music by Carlo Cruz.